deviation. Okay, I remember them saying something about heart failure. So let's talk about heart failure real quick. I don't know what he wants you guys to know about heart failure, but let's just talk about it. So this is your heart, and this is your right side, and this is your left side. Just remember this. When you have a right-sided heart failure, for me, the R looks like a B. Just know it'll back up into the body. And if you have the superior vena cava, the blood will start backing up this way, and it'll back up into the centralized veins. And that's why you want to do some CDP monitoring. You'll have jugular vein distension. You will have systemic issues down to the other organs. You have the liver right here. The liver normally gives, it filters blood that receives from the GI tract. And then when it only has the CO2 left, it pushes that blood via the hepatic vein into the inferior vena cava. But if you have heart failure, the blood will also back down this way. So you'll develop hepatomegaly. The liver will get bigger. The blood may go into the hepatic portal vein, go back to the GI tract. You might develop esophageal varices, splenomegaly, stuff like that. That's right-sided heart failure. Remember, it backs up into the body, jugular vein distension. Since the fluid is going into the tissues, you may have peripheral edema. Again, body, okay? Your urine output will decrease throughout the day because the fluid's not in the vessels, it's in the tissues where it's not supposed to be, so your urine output may decrease, but you may develop diuresis in the evening times when that fluid slowly goes back to the vessels. When we talk about left-sided heart failure, just remember that the left receives blood from the lungs, so if it backs up to the lungs. So all of your signs and symptoms are associated with pulmonary congestion, crackles, orthopnea, the hemoptysis or cough being a bloody tin sputum or frothy sputum. You'll hear crackles, stuff like that. That's the main issue with heart failure. You give inotropics like digoxin. You could give medications that reduce blood pressure as well. It just depends on what the doctor orders. Okay, so that's heart failure. Iron deficiency anemia. Just remember the food items that contain iron. Know that iron deficiency anemia, you must treat it by giving them iron, whether it's supplements. If you give them supplements, remember that iron supplements cause constipation, so you might have to give more fiber in the diet, more fluids, stool softeners, stuff like that. If you're giving it through the IM injection, it's a Z-track method because it stains the skin. If it's for a child, they must use a straw or something because they don't want to stain their teeth. And they absorb best when taking a PO with acidic in acidic environment, so you can give it with ascorbic acid, vitamin C, orange juice, stuff like that. And know that all your green leafy vegetables contain iron. And also remember that organ meats are high in iron as well. Same thing with beans. And then labs to expect with diuretics. Well, if you're giving things like Lasix, then you're going to expect hypokalemia, hypocalcemia, stuff like that. If you're giving medications like spironolactone, potassium-sparing diuretics, you're going to have hyperkalemia, hypercalcemia, stuff like that. So make sure you guys remember those points.